thankful to all of you who have participated in the September challenge. So, what the Edmo September challenge is, we've been doing this since the last couple of years, but it's been growing in size. This year, we were really fortunate to have more than 300 participants who were in the challenge itself. And it's a fitness challenge and a diet challenge. And at the end, I'll ask Dr. Muthu and Dada, who have been watching as sort of coaches, and I see other people joining in, what their opinions are. But for today, the topic is all about running. And I don't want to be talking a lot myself. So I'll introduce both our fantastic speakers or coaches, hopefully friends to all of us soon. So Brigadier Professor Dr. Muthukrishnan has become a dear friend over time as we found our common passion. We've been giving talks at endocrine diabetes meetings. He's currently the head of medicine and endocrinology at AFMC Pune. So we are grateful for your services. He's 54 years old. He has been running marathons since 2010 and he has done 32 full marathons. A lot of runners on the group will appreciate. That's a 42-kilometer run, including 42.2 to be precise, including Berlin, Tokyo, Chicago, and Boston. Several half marathons. His personal best time is 3 hours, 17 minutes. And his philosophy is he loves to make more people run. Sorry, there's some construction in the background over here. And hopes that he can convince all of you also and teach you really how to simply do this. Okay. Sorry, I was just giving a call out to my staff to see if they can get this to be shut next door. Okay, and now over to Dada. So Amit Bhattacharjee, Ankit, if you can show Amit Dada. There he is. Yeah. As you can see, they both selected running outfits for this, which is very appropriate. And he is, as a lot of us know him, but there's a lot of my clients here and my Edmo family here, that he is someone who has been a guru and a mentor for a lot of us. And he just leads by example. I know him personally. Sort of, I would like to say I'm disappointed I didn't get to know him for half of the time I've lived in Ahmedabad. I only got to know him in the last 4-5 years. Thankfully, decided to do a Porba health checkup, and that's how we connected and we got to know each other. And since then, it has been a remarkable journey. What I thought is interesting today is Muthu is an endocrinologist, takes care of patients with diabetes, and Dada is a diabetic himself. So, no, you don't have to be limited by disease, by age, as both of these runners will prove to you. They are working, they are limited by time, but you still manage to find time to stay fit and healthy. Dada similarly believes in promoting more and more people, into running, but I don't want to give away everything because there are a lot of things that have happened. He is passionate for all kinds of sports from childhood. Now, what happened is he did develop diabetes along the way, which kind of, I think, prompted his running journey, but I think we'll hear it from the horse's mouth. So without further ado, may I first invite Dr. Muthukrishnan, and if you will, in the next several minutes, tell us about how you got into running, your running journey, and then tips about running for everybody. And the audience, I encourage you, we want to make this interactive. Please put your questions in the chat box so we don't miss anything. So Muthu, over to you.
Yeah, thank you, Rucha, and I hope I'm audible and clear. Yeah, so I'm actually very grateful to this venture that you've started, and I can see so many enthusiastic people. To introduce myself, I'm Dr. Muthukrishnan. I've been running since 2010. That was when I was 40 years old. There's nothing great about my running till then. In the army, you have to run a little bit every year to prove that you're fit enough. So that was about 5 kilometers, which I used to do. But I finished my endocrinology training in 2009, and Rucha will agree. Once you finished your academics and you have more time at hand and like raring to do things. And the new thing that I picked up at that age was running. I started a bit abruptly, and first half marathon I ran within few months of having started long distance running. And since then, I have run the volume that she spoke of. But most of that volume was initial few years when I was not aware how one should space it out, and I was pretty novice. And those were times when you didn't have too many people to guide you. Very few actually ran long distances, and thereafter, over the years, I have actually slowed down in the sense that I have become very selective about my running. But what I've added is passion to make others run, because I've seen how beneficial it is, both as an endocrinologist and as an individual myself, how it helps my patients, how it has helped me physically to remain healthy. And so 2015 was the time when I had come back to FMC as a faculty in my own department, and I started a marathon club for the undergraduate students. Which started off with very few students, but now there are hundreds of them who run. And it's so great to see that age of 18, 19, they are running distances of 42 kilometers, which was unthinkable in my times. And they are finding the benefits. And right now, over the last few years, back in the department as head of the department here in FMC, I have put both together. I have put my students who have run and now become physicians and endocrinologists themselves, and also my patients who have found benefit from it. And now most of my groups where I have my patients or I have my colleagues, I have actively tried to inculcate this good habit. And as we go along in the conversation today, my aim would be to tell you how I did it and how my favorite students did it and how easy it is for anyone to do. It's nothing great. Yeah. Thank you, Rucha.
Okay, so very short and sweet. I think we already have a question for you in the chat box that can you give us tips on how to start running? Vaidehi Kapadia has asked, can you give us tips on how to start running? So you could answer that now, and we'll of course come back to all these at the end. But I think it's a good opportunity,
Yeah.
and then we'll see.
Yeah, thank you for the question, Vaidehi. I think this is something which a lot of people ask me when I insist on people starting to run. The first question they ask is that because everyone, when you think of a runner, you actually visualize elite athlete, that's whom you have seen. But let me tell you, 99% of the runners in this world are like us. They are amateurs. They have just started running. Most of the people start running later in life. As students or kids, we might have run, but we generally lose out in between. We get into busy lives, careers, and things like that. Uh, it's not difficult to start running. The only thing is that we need to undo a lot of things. Have done all the time working, studying. You need to build up your uh, active core and your muscles, especially the lower limbs, which till then you've been sitting and making it weak. So, what I suggest for people who want to start running is to first start walking. And a lot of times, there are people who have already been walking and always felt that running is far tougher than walking. Actually, it is not. The only basic difference in running and walking is that while in walking, at most of the times, both your feet are on the ground. While you're running, at always the one feet is above, and so your body weight tends to be on one leg all the time, and so you need to have better leg strength. So people can just run for a few steps and then they get very tired because of this reason. So what I did and what I advise most of my friends is that when you start slow and start with very few steps. It's not important to see how long you have run or how fast you've run. What you do is that you decide that today I am going to be on my feet for half an hour, 45 minutes. You are already walking, it's easy for you. And in between, put in a few steps of running. You will find that you may not be able to run beyond a few steps and you start walking again. But the time that you're going to be on your feet is going to be there. So again, again, run for a few steps and start walking again. You may get breathless, but when you walk, you are again regaining your breath. A lot of times, people start liking that feeling of that breathlessness and that ability to run, which till now they thought they could not. And this phases of running steps increases and phases of walking breaks in between reduces. All you have to do is decide that, okay, for this much amount of time, I'm going to be on my feet today. That's how it starts. And you would find that over a period of time, you are walking less and running more. Try that and you will find the difference.
Great. Thanks so much, Dr. Muthu. And we will come back to this question again because I'm going to first ask Dada to come on stage or come on screen rather. And let's hear his story. And yeah, there you are. So if we can hear from Dada how he got into running, and this is not from a doctor's perspective, because as doctors, we are supposed to be healthy is what everyone thinks, but trust me, we are not. So
Not at all.
we are a small group and we also spend time convincing our doctor colleagues that why you need to spend time doing this with yourself so you can tell your patients. Dada, over to you.
Am I audible?
Yes, yes, yes. Go on.
Okay. Thanks. First of all, thank you for this great opportunity. We were just to start with, like, while doctor was talking to me, Rucha was talking to me, because 30th was a very important day because we need to have this today. So she was very. So I decided I need to take a leave from my office to actually.
That was so sweet of you. Thank you so much.
So,
Yeah.
that's because the way she is trying to do and promote health and the way she does. I'm not saying not many doctors does it. I mean, a lot of doctors have now become very sincere, and like Dr. Muthu, and he's exceptional. His timing of 3 hours 17, I'm shocked. So basically, uh, a lot of doctors are running, but she's one who's actually trying to promote people also should start become healthy. So it's not only medicines which is you go to the doctors for. She's one doctor who will actually tell you to do other things also to make yourself healthy. Like the person somebody had shared just now, like she's so happy, like her sugar level has come down, so which is really really good to know. So I started running, just to tell you, like this, because I had a lot of bad habits, like I'm a corporate guy. So the Saturday Sundays were fun. I mean, that was I used to work for Saturday and Sunday, and Saturday and Sunday would that be, I mean, a lot of things. Like I was a very chain smoker also, so a lot of things were happening. Like my favorite drink was every week I needed to have Coke and all those stuff. So what happened was around 12, 13 years back, I was getting very lean, and somebody told me in my family, like something is wrong with your health, just get a health checkup done. And coincidence, like there was a sugar test in my society. So I thought, okay, let me also go for it. Actually, my wife pushed me. And the report which came was shocking because a lot of you don't know the numbers. So my number was 540. So so I immediately went to my physical physician doctor. Dr. Dipesha he's quite healthy, and he's very he was doing a lot of cycling and all those. He told me, like, Amit, you are very lucky that you are not gone into a coma kind of a thing. You need to change your lifestyle. So that's when I got the first figure, and then that's when I started. Okay, let me start with walk, and one more thing which helped me to come back so strongly is I've seen a lot of I lost my dad when he was very when I was a kid. So I normally hated going to hospitals, and all the stuff. So I said, okay, so that's not I should not be completely dependent on medicines. I need to come out of it. So that's what, and as Rucha was saying, I was into sports, and also I said, as Dr. Muthu was also saying, we all, at youngest ages, we used to be always doing some kind of a sports activities. So I was good in cricket and all those stuff. So I said, I need to get back. I need to come back stronger. So that's when I started walking, and slowly it all started with walk. And then, as Dr. Muthu said, it's you guys also have to start with walk. So I started with the walking, and then what happened was there was, I just to quickly tell you, like, I find competition in everything. Like yesterday there was a race. I tried to challenge some of the young chaps, and I could beat them. So I'm that kind of an attitude guy. So I had that attitude. So there was one walker who used to be in the park, and then he used to be so fast I could never beat him. So he was so fast, and I always remember like doing brisk walk. So I always tell people also you should do brisk walk. There are a lot of people do walking, but I doubt how much it is healthier. It's actually helping them. So I used to do brisk walk, but he used to be very fast. That's when I said no. I didn't need to move into. I started running in between, and then like one lap I used to run, the next lap I used to walk, and all the stuff. So that was how I started beating him. So that was just I mean, giving you this example just to tell you, like, you will also have to do similar kind of a thing to start running. So you have to start with your walk, then go into brisk walk, and then slowly build your walk and run, as Dr. Muthu said. And then then eventually you'll see, like, the day you do a 5 kilometer completely distance, then you will be actually doing more than that. You can go up to full marathon, 42 kilometers also, it's possible. So that's how it all started. So now, after all these medications have come down, Dr. Rucha is always there to support me. And a few last couple of days, I mean, last week only I had visited her. So I'm in good hands. You guys are also in good hands. So, and she's very particular. She's not that, like, medication is the only way forward. So the way she is promoting across country, I mean, that's really, really remarkable. So that's how it all started. So yeah.
Great. I think that's fantastic. And I think I'm going to start off with a few questions to each one of you. And then I see questions and I'll try to incorporate from the chat box also. And we'll go ahead from that. So what I wanted to ask you, Dada, because you said something very important. You got diagnosed with the diabetes and that triggered you. And a lot of people who will come to us, something triggers them. Now, can you tell, we do have a lot of clients with diabetes, or how do you work on your food and nutrition, when you're going to run in the morning and your medications, how do you adjust that? First of all, do you think running is safe if you have diabetes, or you've not yet shared one other part of your medical history, but maybe we'll get to that in a few minutes.
Yeah.
That, yeah. So is running safe for diabetics, and has running helped you to control your diabetes, and how do you adjust your medication and food? And then I'll ask Dr. Muthu the same question. What do you advise? Is Dada doing the right thing? Maybe, trust me, he doesn't follow everything I say. So it's not all me over here, as a lot of you know. Yeah. So go ahead, Dada. Yeah.
Yeah. Okay. Uh, so just to quickly tell you what I exactly, I mean, over the years, like over the decade, I've been running more than that. So I have actually also evaluated as a because, as I said, like as I shared, my habits were very wrong. There were times when I used to do marathon. Like I had once, Dr. Muthu had been to your place, like Pune, for Pune marathon. All the while, I was thinking, like, once I finish off, I had my my bhanja was there, so I had told him, like, the moment I finish, you need to give me a picture. So he took me for that. So that was the actual thought process. Like, okay, I want to run. I want to also have those kind of stuff. So those were the things. Then slowly, what happened was, slowly the habits started changing. My smoking actually had stopped long back before that, and then my intake, like fast food and all those stuff, have changed. So right now, my foods are basically, if I tell you, like, I've completely, although I'm a Bengali chap, so Bengalis have, two things we have. One is rice, and the other is fish. Both I have stopped basically. So I don't take rice. I only so I'm in millets.
Somebody is needs to mute themselves, please.
Yeah.
Ankit, can you check?
Yes, ma'am.
So now I have moved into millets, Dr. Muthu. So basically, I'm having those positive millets. I keep a rotate. My family also is into it. So my wife is very particular, and then we have so that's one thing which I take as a staple thing. And with that, I not take normal more of vegetables. Eggs is something which I'm fond of also, and which is also my protein. Basically, the most protein comes from that basically. And my nowadays, like foxtail millets has its own protein content. So I'm trying to manage around. So that these are the food habits which I have. So basically, my breakfast is a little heavy, and then afternoon is light, and then dinner. I mean, these are the three kind of uh, combinations I have. And uh, otherwise, yeah, more or less. But I have cheat days also. I have cheat days also. I always believe in cheat days, and I do cheat days.
All right, great. So, Dr. Muthu, if you wanted to say, when you have a diabetic patient or someone with diabetes approaching you, what would you advise them to do pre-run, post-run, or is it safe? Didn't answer my question. You feel safe running with diabetes? Because I think people need to hear that.
Yeah, I actually more since I started running. I mean, it has very good example is during COVID. I mean, I could my sugar level again shot up because at that point of time I was not able to do a lot of my running and all those stuff. So my drastically had to reduce my. Although I tried to do a lot of things at home, but after that the sugar level just started rising like anything. So it shows that if you are into some active sports or you are doing some kind of a cardio activities, your sugar level is definitely is going to be controlled. Now it is stuck at some number which is because of some other reasons. But at the point same time like at this, so the moment I stop my workout. Say like I've seen I can now feel it. Like you say after an event for which I've trained, and then after the event I take a slack period. So in those period I can understand my sugar level is again. So definitely my physical activity is actually keeping my sugar level under control.
Perfect. So, Dr. Muthu, over to you to answer the question. What do you, is it safe for diabetics to run from your standpoint? And what would you advise generally somebody new? Because Dada is a very seasoned runner, but when someone new who has got, we're seeing a lot of diabetes, pre-diabetes, what should they watch out for?
Yeah, especially diabetics, but for everyone in general. If you are starting off with an activity which is not the thing that you've been doing regularly, and running can be intense for somebody who's not been doing anything. So in that situation, one has to be very careful about when you start. Uh, you need to take care of the fact that you do not have any underlying heart problems, and because that is something which can worsen while you start something intense like running. And in that and that's the reason why it is more applicable to people with diabetes, because diabetes makes you more prone to have heart problems. So if you are older, that is say 35 40, and or you have diabetes, in both case you have a risk. Plus if you have a family risk, people who've had a history of heart problems in younger days. Now these are situations where you need to ensure that you get a heart checkup done. So what I do is I don't differentiate so much. I tell all my patients that you have to get it done before you start this activity. So at least a basic ECG and echocardiogram is something which is required enough to tell you that your heart is okay. You don't have a problem which will put you at risk when you start exercising to that level. So yes, it is extremely safe for diabetics to run. It's not just safe, it is extremely effective as a part of their diabetes management. So one should do it. It's safe even for patients who have heart problems, actually. The only thing is that you need to plan your exercise. Like for example, if you are having diabetes, you can still eat something which is sweet, but you need to define the quantity and how much you can eat and how frequently you can eat. Similarly, if you have a heart problem, you can exercise, you can do intense activity, but then you have to ensure how much is that intensity and is it safe for you, which can be decided by doing a ECG, echo, and in the next step would be to do a stress test, which will tell you what intensity of activity is safe for your heart. So that is something about whether it is safe. The other aspect is about nutrition. One thing that I must warn people who want to start running or already are running, people around you will tell you that since you run, you can eat everything, which is definitely not true. Even for people who do not have diabetes, even for people who are not obese, if someone tells you that because you are going to run 40 kilometers once in 2 or 3 months, rest of the year you can eat whatever you want, is not true. What you can exercise and lose is far less than what you can eat in few minutes. And that's the kind of calorie dense foods we have around us. So we should be very careful about that. So even, I'm sure Amit also follows that principle, that despite doing this kind of intense activity, we still look after our diets. We still we watch what we eat. And so that is something that one has to be careful, because I've seen people going into a release kind of phenomenon. The moment they start running, they start eating everything, and then they say, मैं दौड़ता हूँ लेकिन मेरा sugar कम नहीं हो रहा. So I tell them that diet, what you're doing already has to continue. Along with that, you can start doing this exercise. But yes, what running would do to your diabetes, as far as the nutrition aspect is concerned, is you have to tailor make your nutrition accordingly. You will require some carbohydrates before your activity to fuel your exercise. Your exercise fuel is mainly carbohydrates, so you would need some carbohydrates. So diabetes patients, I would advise not to exercise empty stomach. They need to eat something, preferably if they are on a drug which can cause low sugar. They should also ensure that their sugars are not low when they start exercising. And the other thing is that protein intake becomes a very important aspect when you start exercising, because your muscle damage due to exercise has to recover, and that requires protein. So as a normal person, your requirement may be just about 0.8 grams to 1 gram per your kg of your body weight. But if you're doing this kind of activity, your requirement may go up to 1.5, 1.7 grams per kg, which is almost half, 50% more than what you're already eating, proteins that is. So your intake of protein has to improve, and that should be healthy protein. So these are things that you should watch for. And along with that, the supplements, like ensuring that your hemoglobin is fine, your B12 levels are fine. So your iron intake should be adequate, and vitamin D, which is very important for muscle. So, and calcium, especially in perimenopausal and postmenopausal age group women and older men. So these nutrition aspects one has to take care. Lastly, there are a lot of nutritional things which are available for runners, which is supplements, pre-run, post-run, hydration drinks with excess amount of glucose in it, or not just glucose. There are certain carbohydrates which are fast absorbing, which are not glucose. They are maltodextrins and things like that. They can shoot up your sugars very rapidly, especially in patients who have diabetes. So in such settings, you don't have to overdo it. If you have diabetes, you need to check your sugars, even sometimes during your exercise, if the exercise is going beyond 1.5 to 2 hours, and immediately after, to see whether your sugars are behaving or they are going up or low. And generally, according to your sugars, you tailor make your nutrition pre-run, post-run. That should ensure that your sugars are generally between 100 and 200 while you exercise. And that will also help you keep a good check on your overall sugar control rest of the day. Yeah.
Great, perfect. So I think that's fantastic. Do you yourself, Dada or Dr. Muthu, the audience wants to know, the nation wants to know, do you take any protein immediately post your workout or run? Whey protein, plant-based protein? Like a fast acting, because it's hard to eat 2 grams, 1.5 grams kilogram per body weight. Yeah.
Yeah,
Dada, do you
I
take?
do.
Yeah.
Yeah, please go ahead.
I think, Dada, can you hear us?
Yeah.
Madhu,
Uh,
yeah, I was asking
Yeah.
if you take any protein powder immediately post-run.
yeah. So, as Dr. Muthu said, it's very important that your intake, there are supplements also which is there. I mean, it should have a rapid digestion process as such. So, like, I always believe in that. So, whenever there is a long run, or say my long runs are, say, around more than 2 hours or something like that, I'll always ensure to take protein immediately after my run. So there are products I'm associated with one product company, so they actually provide me that. So I have that. So definitely yes, around about 20 grams I take after the run. So it depends on my intensity and how much duration of my run is. So yes, I always take protein supplement
And
after my.
how about you, Muthu? Do you take any protein immediately after your run?
Yeah, I'm basically a vegetarian. I do have eggs, but routinely I don't eat chicken or something. So my source of protein is from eggs plus whatever rest of the vegetable proteins. So I do take supplements. Uh, my protein supplement is plant-based protein. Earlier, I used to have whey protein, but I found this one has better effect on my lipids. So I generally prefer this. And I take about 25 grams of supplement as far as that takes care of 25 grams, but rest of it comes from eggs and the foods that I eat rest of the day. What I've realized is that in our diet, the protein is what is lacking. And I'm a South Indian, so most like Amit said, he also eats rice, and he gave a price, but I cannot give a price. We just it's not about because
Yeah.
it's easy to make and both of us are working, so it's easier that way. So I do eat rice, but then things which you eat along with rice makes it sure that your rice is also effectively handled by the body.
Great.
Yes, and I try and ensure that for my weight, I need about 100 grams of protein. So I do manage to reach 70, 80 grams. It's not all, but like what Amit said, the day I do intense activity or I run longer than 2 hours or I do go to the gym for more than an hour. So I take a supplement again at night, which is a different supplement. This is also protein, but it is a slow release, a slow absorbing protein that takes care of recovery overnight of muscle fibers. Daytime morning that I take immediately post run is a fast absorbing protein. So we have to ensure that it's a good quality brand because there are lots of brand in the market which may not be safe. And recently there was an article in paper. People have found that a lot of supplements are bad. So protein, if you're taking or any supplement for that matter, please ensure that it's of a good brand. It may turn out to be a bit expensive, but it's worth it. Yeah.
Perfect, super. So I'm going to summarize in 30 seconds and then get to a lot of questions in the chat box. I need to get to the audience questions also. So far we've heard that, and of course, everything may not get covered, but we will post this video later that anyone can start running at any age. You need to be aware of any major medical problems, joint problems you have. As Dada and Dr. Muthu both said, learn the run walk technique, and there are standardized protocols we can share with you also as to how to go about that if you don't know. Focus on the intensity, and they usually say if you can sing as you run or walk, talk as you walk or run, that's a good sign, and that's the easiest way to do this. Very important if you're diabetic to pay and attention to your sugars, medications, checking your sugars before, during, after, which we do easily nowadays with several monitoring devices. And protein is very, very important, making sure attention to diet,
One
but
more
protein. So,
One more
yeah, go
thing,
ahead.
just that, I mean, Dr. Muthu was saying, which is very important, I think, which is where we need to focus going forward. I mean, that is, I mean, the medical test of, I mean, if you start, before you start your run and all, you need to get your medical test done. I mean, that's very important because what happens is you get carried away social media and seeing people running around. So, best thing to do is get uh, uh, connected with a good consultant doctor and who is into healthy habits, and then take their advice to get some medical tests done, like few tests Dr. Muthu has already suggested here.
Absolutely. So yes, I think we had, in fact, we are part of Ahmedabad Distance Runners (ADR), and a lot of the runners have joined today. So ADR does this annual around World Heart Day. We'll release a program specially for them and encourage everyone to go and get their blood tests, heart testing, everything done. And they also come and do body fat analysis and all that. So I'm going to get to a question by Dr. Gursimrat Paul. Is he still there? Dr. Gursimrat, Ankit, can you put him on the screen maybe? He says he's a practicing plastic surgeon and how to cope for the training schedule. So I wanted to get to this part of the stress about running also. For my first full marathon, I'm getting tired very easily after long OTs. So how to create work-life balance? So I think running is really, to me, it is a harmonizing activity. So I was going to ask, since we have both again Dada, who has got his family, and he also cooks his own meals, as I was just told recently. And then also Dr. Muthu. So if we can help Dr. Gursimrat recover and take care of his long runs. Because I know a lot of ultra runners on the group. Pratish has joined, so he's also a doctor. So I think this might be applicable to Bhaskar and Pratish and everybody. Yeah.
Yeah, I'm glad you run. Every doctor that I see run, I'm very happy. They are a very rare breed, but it's increasing now. And our patients would believe us more if doctors run. The other aspect to your profession is that your profession involves standing for long times. Your surgeries are very long. So it's pretty hard on your thing to actually train for an event and run. It's going to be tough. And it's very difficult to actually balance it completely. Both are important. So what I would suggest is that one thing is that I didn't get your age, because that is something will also decide your volume and intensity.
How old is he? Do you know that? I'm not sure. Must be my age only. Similar, 40s?
45,
So
45.
yeah, okay, good.
There he is. Let's put him on the screen, Ankit. Dr. Gursimrat is right
Yeah.
here, still at work. Let's put him on the screen.
Yeah,
if we
actually,
can.
Yes, hello,
can
hello
see.
everybody. Hi.
Yeah. So the point is that your whoever is the coach who's planning for you, I hope there is somebody
Dada,
who's
Dada is there.
okay. So your program has to be tailor made in such a way that it fits into your. We all have busy lives, but our coaches decide. Sometimes you don't need to run all days of the week, definitely, but even up to 4 days a week is good enough. So 4 days a week of running and about 1 or 2 days of strength training and recovery is a good volume for age beyond 40, 45. So what I would suggest is that you put these 4 days into your schedule when you have time, or when you have time to actually recover completely. Because I know after having done a long distance, you can't go and stand in the OT for very long again. So you need to put those 4 days rightly there. But the other thing is that what you do in the morning for 1 or 2 hours is not as important as what you do for the rest of those 20 hours in office or back at home. So ensure that while you rest while you can, keep hydrating while you can, and ensure that despite your tough schedule, you are having your meals on time and your meals are healthy. Surgeons and anesthetists have this habit of eating samosas in the OT. So please give up on that. And if you do that, and I have seen most runners who are surgeons, they don't, even in the OT, if samosas are served, they don't eat. So you have to change the way you work, as in the days you are working, that's fine, but rest of the days when you're running and you need time to recover, you are changing the way you work. And say you're sitting in office for long, put in something under your feet which will ensure that your feet are constantly moving or your calves are getting massaged. Because you're standing for long, your varicose veins is an issue. So for runners, it's again an issue. So if you take care of those aspects, I think you need a very personalized kind of.
Somebody needs to be muted, Ankit, again. I don't know if it is. Yeah, there we go. Okay. All right. Okay. So I think, it's a tough call always, but this may not be possible, but I'll suggest take a 30-minute nap in the afternoon. That
Oh,
works
it's
for
not
me.
possible. Not in the OTs.
You need to find a corner, snooze. Can you not snooze? I can sleep anywhere, I can snooze in 15 minutes anywhere. But I just wake up.
Physicians can, Rusha, not surgeons.
Not surgeons. I'm
Come
constantly standing
on.
from 9 to 4.
At least not when I am the patient.
Well, the question is, should I attempt for a full or not? That is what I'm thinking
No,
about. I've
no,
done so many.
you must, and
Okay.
there is no profession which is busy to do a marathon. Let me tell you that much. You
Okay.
must do it. So you also need to set your targets back. If you have a busy schedule, you don't have to aim for the best.
Yeah,
You first
true.
anyway, since it's going to be your first marathon, whatever you do is going to be your best. So don't
Yeah.
worry about your timing. Don't worry. Only thing is that you should be able to finish it in a healthy way. You should be able to come back Monday morning to work again, even if you've run a
Right.
full on Sunday. So that kind of vision, if you have, the problem is we set our targets too high. We try and compare with somebody who's done it better than us earlier. It's not important. He's not a plastic surgeon. He's not Gursimrat. So if you set your goals according to what you can achieve, you will always be happy at the end of the day. And let me tell you, 42 kilometers is 42 kilometers. Whether you do it in 3 hours, whether you do it in 6 hours, it doesn't matter. There are less than 1% of this population which does 42, and the timing is not important. Yeah.
Right. True. Thank you.
Okay.
Thank you very much.
Okay, and then now I just want to. So somebody has asked a further question about how to know about your hydration during and post run. I think that would also tie into, Gursimrat's question also, because maybe he's not adequately recovering, taking enough electrolytes. And also, is it if they experience headaches post run? Dada, do you want to comment on the hydration? And also, a question right up your alley is breathing. Can you comment on breathing exercises for running? So I think that is something that, yeah, what kind of breathing technique should be used? Somebody, whether he has asked, yeah.
Okay. So hydration, although I'll be talking about it a
Ava
little,
has asked that, yeah.
so Dr. Muthu would be the best person to actually give us a thought on that. I mean, how to take it forward. So what I can tell you what exactly I used to do. There was a time when I used to be a big show off, like 20, 25 kilometers without water. So that was kind of a thing which I used to believe, and I used to talk about it, like boasting about it, kind of. Now I feel I mean, so embarrassing that I used to do that, and I used to talk about it. But basically, hydration is very important. I always give this example because I'm into intermittent fasting also. So this is one example which is given in intermittent fasting. So it's like fuel is very important. Like it's like a car, vehicle, which goes. Well, so like a vehicle needs diesel, it needs, say, if it's whatever fuel it requires, then it needs lubricants, everything. So for the vehicle to run. Similarly, our body also needs all these things. So stuff, the food I normally take. So that's what actually tells me what good food I need to have, what bad, because my thought process is always my brain all works that way. Like something comes in front of me, a samosa comes, so I look at it as a fuel. So is it going to help my body? So that is how find out which is good for me. So so fueling is very important during so for the runners especially. It's very important when you start the run, how you start before you start your run. There are nowadays products which are there. These are enhance your nitric oxide and all the stuff, but definitely there are products. And then you during the run also you need to have replenish your carbohydrate, your a lot of minerals. So basically minerals is something which is needs to be focused. So you need to replenish them while you run, because it's a vehicle which is moving, and then you are trying to cut down on your food. All I mean, it's not at all advisable. It is not going to help you. So even if as a runner you are not able to recover, one of the reason could be your fueling is not proper. I mean, you need to see your fueling is proper over and above protein and all the stuff. So that's one. I think Dr. Muthu can add further on that. So
Yeah, this point about hydration, if I can answer. uh, it's very individual, the amount of water fluids we require, because our sweat rates are different. Some people sweat a lot, some people sweat less. And the only way to actually find out whether you're hydrating enough is to actually look at the color of your urine. You must basically, the idea is that if you are hydrating enough, your urine will be slightly yellow, light yellow. It will not be absolutely like water, which means that you're drinking too much of water, or it will not be too dark yellow, which would mean that you are under hydrating or drinking less water. So the best way over the period of time during the day or immediately post run, if you find that your urine is very dark, that means you've not consumed enough water. That's a very simple way of ensuring. If you want to be slightly more scientific about it, there is something called sweat rate. So what we do is that we run or we do our activity exercise for about 1 hour, and that's the time which will tell you. You weigh yourself with least amount of clothes before the run, and you weigh yourself post run. And if you have had any fluids during the run, you just remember how much you had, and you minus that from your weight, and you will find that you've lost some weight after the run, and it is all water. So it will also tell you how much you have sweat. And a lot of us would not believe when you actually stand on the machine. Like I myself, I can tell you that if I run 1 hour in during summer months, I might have lost about 2.5 to 3 kgs, which basically means that 3 liters of sweat and 3 liters of water to be drunk during 1 hour is impossible. We cannot drink that much of water. So becoming dehydrated is normal during running, but we should not get too dehydrated. So hydration is that way can be measured, and looking at the urine during the day. Rest of the day, how you hydrate yourself is also very important. It's not that just 1 hour. So keep ensuring that you're having adequate water. Even if you are working, just keep something in front of you so that you are regularly drinking, and keep looking at the color of your urine. It will give you a good idea. Yeah.
I think that's a very good hack to do the weighing thing, because I think Ava, hopefully maybe you can try this out and let us know if it benefits the post-run headaches. Dada, do you want to talk about breathing techniques for runner? What technique to use?
Uh, it's one of my favorite subject actually. Everybody knows about it. So I've done a lot of because whatever my involvement, whatever as a runner, because just to tell people, I'm more into ultra running. So it is, which is much more convenient for a diabetic patient, because you remain in your aerobic zone. Most of them, your heart rate is controlled, so you're running slower, and then so that's one thing, and then at the same time breathing is very important, because breathing is something which is now it is over the everywhere, across the world. It is now realizing the importance of breathing, even for so there are a lot of so basically, if I tell you, if I go into depth of it, like initially I was of the opinion that okay, you need to breathe through your mouth, which is actually the proper way. I mean, we have as humans, we need to correct ourselves. That is, it's like we need to breathe through our nose, because there are reasons for that. I mean, it's actually when you breathe through your nose, then your diaphragm gets activated, and then it comes to your lungs, your lungs, and all. So that's just the proper channel of your air to go inside your body. That's how it gets your oxygen gets distributed to your body. So basically, you need to breathe through your nose. There is one more important thing which I'll just touch base upon. There are products which are there in the market, even so like nitric oxide. So nitric oxide actually can be produced inside your body, so which is comes from your nose, like your sinus. So when you take your breath inside through your nose, so the nitric oxide gets released and goes to your diaphragm, and then it gets released. So basically, भगवान ने हमको यही बनाया कि we use our nose for breathing and mouth for eating. So try to do that. So one thing which is very important for new runners, or somebody wants to transform into running, this is a very good indicator for you. Like as Dr. Rucha was saying, like you can talk something, a complete sentence, song or whatever. Similarly, when you are able to keep your mouth shut and try to run with your breathing through your nose, so you will be always in a slow mode kind of a thing. You will be in a controlled phase. So if you move out, then you actually, your mouth will open up and then you start, taking a lot of air through your mouth. So to avoid that, you can actually, so as a runner, when you start running, so you can actually do that. I think there has been a lot of my improvement overall physically, and my performance has improved once I started correcting my breathing techniques, and my sleep has, my recovery has improved. Like when I sleep at home, I tape my mouth sometimes, so I have my snoring and everything has stopped. So a lot of things are there in behind it. So, but basically, any runner or anybody wants to start running, you have to try breathing through your nose. So, and then breathe has to be very slow. Like there are there were times previously, even now also, there's a lot of people will tell you, like, there is a, like, cadence. You match your breath with your cadence, like, to, like, if you're running fast, like two steps you take breathe in, next two steps you breathe out. So that's a cadence which, okay, that's cadence is important, definitely, but you need to slow down your breath. When you slow down, then only your air goes to your nose, and then it goes to your diaphragm, and then entire thing happens chemically. So basically, slow down your breath, and the more you slow down your breath, the more you'll as a I mean, it's for everybody. It's not only for runners, everybody. And at the same time, you actually utilize your breath properly by utilizing the oxygen, carbon dioxide. Carbon dioxide is also a very important thing, which we cannot neglect. So that's I think, तो थोड़ा ज्यादा हो गया maybe, but you need to breathe through your nose. So,
We've
that's how
also
you.
seen Dada running not only with a tape when he's sleeping, but we've also seen him running in the streets of Ahmedabad, taping his mouth because, he takes everything to next level. So he wants to ensure people see he's breathing with his nose, and he will do that to promote that. So that is fantastic, of course. Now, how about you want to demonstrate any breathing exercise very quickly in, like, say, 30 seconds, Dada? Because I know you've done a session on this for
Yeah,
runners.
there are a lot of techniques which are there, but the best thing which I feel is, like, which I tell a lot of people, like, every day. I mean, there are a lot of methods which are there. I mean, just to tell everybody, first and foremost, which I want to share here, everything is yahin se nikla hua hai. It's all pranayam, nothing. Only breathing naam aa gaya, that's definitely there. But pranayam, it all started with our Indus Valley and all. It started from here, and then it got across the world. Now a lot of people are there are experts in the West who just they are called a breathing coach. But actually, what they teach is also, it's like the techniques which has been developed from our country. So nothing new, nothing new. It's very simple. So the best thing to do is, like, to slow down your breath is one thing which I do normally is, you 30-second, you can do 30 breath, which is very early morning when you get up, just sit, and then before you go out for your activity or whatever, you take 30 breath. So, like, very slow, just sit still and then make your body straight, and then it relax your shoulders, hands, everything, and then take a slow breath inside. You should feel it inside. You should go to your stomach. I mean, your stomach should bulge. So your nose, when you take your breath through your nose, then only your stomach will bulge. I mean, diaphragm will get activated. So you slow down your breath, take your breath in, and then slowly take your breath out. You can breathe out through your
Can we give
mouth
them
also.
a count as to how many?
So
One, two,
that is
three, four.
30 times you have to do. 30 times if you do, then it really works. I'm telling you, I have
So
seen
they
it,
should
like,
take a breath in counting one, two, three in their mind. Is that what you're saying?
yeah. So number of breath they can take. So one breath will be like one inside, one taken inside, one out is one cycle. So they have to do
Without any breath hold, or should they hold the breath when they like?
nobody has breath hold is, again, it's a part two, it's stages. So initially don't have to, there are box breathing, they call it. I mean, there are, I mean, we have, so those things are there, but definitely one has to first slow down your breath. I mean, what is happening today is, like, we are all this, just to quickly tell you, although I have it's my I should not say, because there are a lot of doctors here and then they are so qualified, but I'll just tell you, there are three things which are connected in your body. One, your breathing is connected to your nervous system, your parasympathetic and sympathetic nervous system, and your parasympathetic, and then the third thing which is connected is your heart, the heart rate. All these three things are connected. So if you breathe fast, your heart rate goes up. You go into, sympathetic nervous system. So if you want to slow down when you slow down your breath, you activate your parasympathetic nervous system better. You make your heart also work better. Heart is a motor which actually just pumps blood across your body. So more it slows down in the way it operates. So that's how you need to try. So that's what I would like to share. I mean,
Maybe we can share some link to some breathing exercise technique for them. So I'm going to quickly, in the interest of time, move to some of the other questions. So how to build the core and suggest Dr. Bhaskar Thakkar, I don't know if he's still here or not, suggest some good core exercise for runners and frequency.
I'm here only.
Yeah, we can put Dr. Bhaskar on the screen, Ankit. Yeah. So we can answer his question. Dr. Muthu, I just saw your WhatsApp status yesterday doing some core exercises, some 8 variations. So I think that's a good question to start with you. Bhaskar, I'll share his number. Just follow his WhatsApp status every day. Ankit, can we put Dr. Bhaskar on the screen? Yeah, Muthu, over to you.
No, it's for Bhaskar, I thought. No?
Good evening, sir.
Yeah.
So, I just want to ask for the runners, what should be the frequency of core exercise if we run 4 as you said, Dada is our mentor and he teaches a lot of things about running, starting from breathing and everything. He is the mentor in the whole city. Everybody runs in the Ahmedabad who actually knows Dada very well, and they take a lot of helps in training plans. So for a runner who is running 3 or 4 days in a week, and as you say, 1 or 2 days for strength and core exercise. So I want to just know that which kind of core exercise runner need, and how much frequency, like for in terms of one set of 40 minutes, 1 hour, or what should be the time duration and the basic core exercise, type of core exercise for the runners.
Yeah, actually, the duration or number of repeats and repetitions and sets, it's all very individual, depending on whether you've been doing it earlier or not, and just starting. So if you're just starting, then it could just be 1 or 2 sets of 5 to 10 repeats. But when it comes to core, it's not a kind of a repetitive exercise in that sense. See, when we say core, it basically means the back muscles, the spinal muscles, as well as your abdominal muscles. And it also requires a strong hip muscles also to form the core. And the most complete core exercise, if you ask me, is the plank and all its variations. So what the standard plank is, of course, what is the elbow plank, which you would have seen. Otherwise, it could be a palm plank where you're slightly more elevated and your arms are straight. Then there are side planks, and there's a reverse plank where you are actually lying down facing upward. So what this ensures is that when you do side planks, it's your side muscles which are active, mainly abdomen. But all these plank movements, positions will ensure that whole of your core is involved. The aim is to ensure that you can sustain it for as long as possible. But 1 minute is optimum, because 1 minute is something that beyond which you will start having fatigue, and it does not have any great benefit. For the sake of record, you may say, I do 2 minutes, 3 minutes, 4 minutes, but 1 minute is good enough. So you start off with 30 seconds, 45 seconds, go to 1 minute. And instead of doing a 5-minute plank and saying that I did 5 minutes, you can do 1 minute into 5 with break, which is even better because your position would be correct, right? So, and when to do it? Actually, if you ask me, most of the exercises that I do most of the day. Like whenever you have time, it's a good time to do an exercise. So a lot of times I'm doing exercise in my office when nobody's watching, obviously. But as a schedule that I follow, plank, these core exercises are best done immediately post run. When you are recovering, when you are actually stretching, putting in some planks during that time. And then when I do the strength exercises twice a week, some of the days that I do devote it totally to the core. But otherwise, core is a part of my recovery routine every day in my post-run activity.
So one is the plank, and we said about.
So if you're building up your abdomen, or you're building up your spinal muscles with exercises like there are those prone lifts when you do in the gym, or when you're doing those crunches when you are lying straight, or when you're building up your hip muscles by doing hip flexor exercises or hip extensor, which are the gluteus medius and maximus. These are also part of the core. When we say plank, this is a more of a static kind of exercise, but all these dynamic exercises where you are using these muscles, building up these muscles in the gym, they are also part of the core. That's so your muscles of the spine, paraspinal muscles, are generally done by prone lifts, when you, like what we call bhujangasana in yoga, where you're lifting up your head part. Similarly, when you are doing those crunches, ab crunches, yeah, and also there are those side crunches which you do, which you may be actually doing standing with hand with a dumbbell in your hand, and moving on either side. That's to build up your side muscle. Is also a part of core activity. Yeah.
Thank you very much, sir. It was very interesting.
Perfect. So, I think that was great, Muthu, because we just had in the first week, I don't know if you were not able to attend, Coach Jaisal, who's one of our strengthening
I did attend that. I did attend,
and he
in
spoke
fact,
about
he spoke about core, and he actually mentioned this very clearly, that core doesn't mean abdomen only.
Yes,
core means a lot of these muscles. Yeah.
Yeah, he said, Bhaskar was very nice. I'll send you that clipping right from here till your hip bones. Because till now, actually, I had never even thought of the glutes as being part of the core. Because we are so focused on abs and, getting your visible abs or not, but at least having a strong core. So I think that was a very valid point, which thanks, Muthu, for reminding me today again. That even if when I'm thinking of core, you need to also work on so many other muscle groups and not just doing a single variety of plank.
So if I can just repeat what he had said, and I remember it very nicely now, that if you take your body as
Hang on one second, Muthu.
solid
Ankit, can
tube.
you please mute someone again is making... Yeah, there we go.
So if you take your body as one solid tube, and you have the upper limbs coming out of your shoulders and lower limb coming out of your hips, it's like those toys that you have. So this part is the core. Your core is very important, because whatever exercise that you do, you're only moving your limbs, and the core has to stay strong while you're doing that. And so core would mean anything from shoulder downwards till your hips, where the legs are.
That's, I think, quite a fantastic analogy for everyone out here. And I think that was a great question. And let's see, 2 more messages. So Preksha is here, I think, and she's asking, does it mean we should do planks post every run? Dada, do you also work out in the office? I'm suspecting that, you must be not even trying to hide it. You're muted, Dada. Huh.
The Dr. Muthu said, like, he does it in his working period also. I was so happy. Like, I have somebody who's so there are no excuses. First thing is, there are no excuses for core, and definitely there are no excuses for core, even if you're not running or whatever. I mean, so something, because you lose your muscle after a certain age, so that's why also it's very important that you need to actually do those kind of core strengthening and all those stuff. So basically, I also do it at office whenever I get a chance. So like my office has recently shifted. Before that, there was a previous office. The pantry boy was also aware. Like, he used to tell me, "Sir, अभी आपका gym खाली है." मतलब the conference room is to be nobody's there. So I used to go there, do push-ups, I do plank, and as I said, Dr. Muthu said, my favorite is plank. I mean, plank, and he rightly said, like, I did those mistakes once. I had taken my plank time to 11 minutes, something like that, which is not at all required. I mean, it's absurd. It is not at all. It's actually harmful. so, so now, and rightly said, like, we need to do 1 minute, so 1.5 minutes max. and repeats you can do, and then you can do any time of the day. Like you are coming from office, you can do it. I mean, this doesn't require three things. I always believe three core exercise which I believe can be done in a lift also. Like I do my squat sometime on in the lift also, like going down, going up. So squat is something which I always believe in doing. Plank
But you
is
don't use the lift. So when are you using the lift?
no, yeah. So office, that was initially, ninth floor and all the stuff.
Yeah.
So push-up is one more thing which I also ensure, like whatever time, there are no such, Dr. Guru can actually during his two operations, he can actually manage to do few push-ups. I mean, so that's how.
Good, Simrat, you're in trouble. Yeah, there we go. So I think that's fantastic. So what I'm just going to again recap the last part of this conversation is that while we are paying attention to how we start running, you need to strengthen those muscles and then it's years and years of conditioning that makes them stronger. Even after years of conditioning, don't be surprised when you just bend over to pick something and you suddenly have a pulled muscle. That happens. So don't get upset and keep on working on these things. But that's where you have to pay attention to hydration. Abha, I just saw you back there. So I'm hoping you heard the answer for how to figure out hydration during and post run. Dr. Muthu gave a very nice hack for that. We spoke all about electrolytes, carbohydrates, fat. I think I want to speak on fat, that do not mistaking good fats post run. So a lot of you will be putting creatine in your whey protein, but if you're not taking either an omega-3 or some fat and a date or half a banana, small banana, something, you will not absorb that whey protein well without a carb. Let me just tell you that. So it's very, very important to have something. I'm not saying go and have sugar in your, chai and all that we do, but make sure that you're having some carb along with the whey protein and really taking your calcium and omega-3 at that time. Also, I feel works for the people who are talking about recovery. And good hydration, good Simrat, I want you to be recovered before you get to work. So that's what we are going to have a chat later after this, and maybe we can give you some hacks over there.
Sure. Looking
So
forward.
I think once someone gets up to a certain, I see Riga has joined the group. So she has got up to 5 kilometers, I know, and she wants to get to 10K. And always that is daunting. She's a busy architect. How to find the time. So I think, how about the progression? How do you know you're getting better? And let's kind of keep that as a last question. And then one take home message from both of you and from any of the runners on the group, please post on the group. So just maybe how to progress, I think would be the last part. Do you need to go get your heart tested again? And then a take home message so we can end the conversation. Yeah.
Yeah, 5 is the basic distance. So anything more than that would require some effort. So 10K is a good target to have. The way we progress normally is that there's a general dictum that 10% increase in your mileage every month. If you follow for an amateur like us, it's fairly okay. So, but when you're starting at a very low distance like 5, 10% may sound very less. So we don't go by that mathematics. But say generally, if I have to progress from 5 to 10K, I would give at least 3 months, minimum 3 months to ensure that I reach 10K distance. That is number one. Two, 5K to 10K will require you to run or at least be on your feet for 1.5 hours at a stretch. So don't worry about the distance. Get used to being on your feet for about 1.5 hours on a day when you have time. Maybe even 2 hours, but 1 hour, 1.5 hours is good enough. Because even if you brisk walk, you will be able to do 10K distance in about 1 hour, 40 minutes or so. So running would take you less than that. So that is one. So be on your feet. That is one. Two, I would suggest that find somebody who's been doing it earlier. And if you get a coach, nothing like it. Because we often try and invent the wheel ourselves, which is not required. There are a lot of people who've already done it. So follow them and at least saves that amount of time and you don't have to do the mistakes that they have done. So that is very important in anything that you do, but running more importantly, catch hold of somebody who's done it earlier. And the other thing is that when you start longer distances, you have to be more careful about your diet, nutrition, hydration. So that aspect, if you are willing to take care, and the recovery aspect. And one thing that we've not spoken much, it was mentioned in passing, but let me tell you, sleep is one of the most important aspects of recovery, which we always sort of underplay as professionals. We don't have time to sleep. We think that sitting or just lying down is good enough. No, your brain has to shut off actually completely when you sleep. And that's why elite runners sleep for 8 to 9 hours a day. We can't achieve that, but we can at least ensure that 7 hours is sleep that we are getting. 6 to 7 is minimum that we must plan to get. And when you start training for more, keep watching your sleep. Also, now watches tell you that whether you're sleeping adequately or not. So all this, if you're ensuring 10K is there for you to just go and grab it. Yeah.
Great, perfect. Dada, over to you. Any? You're muted.
Just to add on what Dr. Muthu said, like sleep is very important. And one thing which you will, because as you said rightly, we did a lot of mistakes. I mean, when I started running, I had a lot of other challenges, like, but there was no guide. But now we have made those mistakes. Now we have a lot of people around to support you, to channelize in your, so that you actually do properly. I mean, and then it is like 10% role, as you said, is what is actually believed. And you don't have to, I mean, it's not, the chances are that you get carried away. A lot of people start the very first year that if you attempt full marathon, which is a 42 kilometers, which is wrong. I mean, you need to actually take it very slow. Entire life, you need to ensure that, because it's a lifetime activity which you need to consider. I mean, so then you slow down, you slowly build up. And to be, what I always say, people, the most important thing about becoming faster or becoming consistent, or starting from walk to run, I mean, you have to be very consistent. So that's one thing which I would like to suggest. Like, you need to be very consistent. Like, say, like 4 days or 3 days of week, you need to be actually there. You cannot switch off completely, again come back. So that actually, although so that's one thing which you need to ensure you should not do. And yeah, so, and then if you find somebody, as Dr. Muthu said, somebody to guide you, that's the best thing to do, actually, to take you ahead. So
Great. I think this is fantastic. No, and so I think consistency is key. You got to get that time on feet, your feet on the road or treadmill or whatever works for you. I was gonna sign off, but I see a very important question that I also had on my list. And Abha, can we put Abha on the screen? I think she's right there. How to choose shoes. I think we don't want to forget our feet that we stand on, and we didn't. There's so many questions, but I think let's address this one quickly, and then I'll get a take home message. Ankit, can you put Ray of Hope Abha on the screen? That's what her name is over there. So do you want to, let's start with Dr. Muthu. Abha, right there she is. Hi Abha. Thanks for joining us. Yeah.
Actually, that would require another sort of meeting. But what I can tell you is that shoes don't matter as much as they are made out to be for the level that we are talking about, for the level of activity that we are talking about. Shoes are not so important. Yes, they are important, as in you need to have shoes which are sort of well cushioned, depending on your size, shape of your feet. So if your toes are wider, then your shoes should not be narrow at the tip. Those things are important. And also the fact that they should be not be too tight. When you actually run for distances beyond 1 hour, your feet tends to swell up. So actually your shoe size for running, as you get longer, have to be slightly loose compared to your usual sneakers that you wear at work. Then the other important aspect of shoes is that, which is slightly more technical, is depending on how your feet land on the ground, whether you are inverting or you're pronator or a supinator. So that is something which the shoe shops of a good brand like Essex would tell you. They would assess your feet and tell you. But to be fair to amateurs like us who have to start very humbly, shoes of a good brand, which as in it could be starting from things like most of the brands now. Brooks is a good brand. You have Adidas, you have Nike. All these have various range of shoes, but to find your size, your shape of feet, and the way your feet land, and not very expensive, which should fit into your budget. Please remember, your shoes would last you for about 800 kilometers. That's what is said, but for our kind of intensity, it may last for 1,000 kilometers also. So at least twice a year, you need a pair. So accordingly, you must check the budget also. So don't be too greedy and buy something very expensive. Shoes are shoes. So that's how I take it. Though I have more pairs of shoes than my wife, but the thing is that they will help you only to a limit. After that, it's all the man who's wearing the shoes or the woman.
Yes, Dada. Since you also run barefoot and everything, let's hear from you. Minimalistic shoes versus the
Uh,
cushion shoes I wear.
One thing which is I've learned over the years is one should not be completely dependent on particular kind of a shoe. Like I always tell runners also, like say like a lot of injuries I've seen, like in my case also, like say like any injury there will be some trigger point, so you will understand like it's coming. So the moment I say I use Vibram, I use Zero shoes, I use normal Adidas, other shoes also. But the moment I cushion shoes also. So the moment I realize some trigger points, some niggling is coming, I immediately change over to the other the other extreme shoes. So and then I realize that never those injury again gets, it doesn't come back. So that's one. So I rotate my shoes. That's one thing which I ensure. And when I take normal shoes, as Dr. Muthu said, you need to go a good brand. I mean, it's always good to have a brand. At the same time, you need to ensure, I mean, for the new runners, you need to ensure you take a size bigger, because that's very important, because your feet is going to expand because of the continuous landing and then thumping on the ground. So your feet is, so there are a lot of people lose their nails and all the stuff. It's very common, although even it happens normally also. But so you need to go for a one size bigger shoes for running. So that will give you that comfort and space for the feet to move. So that's one thing which I would like to add.
Great. Thank you. And before I ask you both to give a take home message, I'm giving you this 10 seconds to think of your take home message. I hope that answers your question, Abba. We have a lot of good runners, but giving really kudos to Sapna Avtani ji. If she can show us her face, I think she is. Yeah, there she is. So she is in her 60, 65, I believe. And yesterday, after the September challenge, she did a 5 kilometer run walk for the first time. And she had sent us a nice video on the personal. So we'll share that on the group. And that is her right here, if you can see. But she did not want to talk and acknowledge all that. Then we have Amit Kumar Jha. He actually did something quite remarkable. He did just recently the Khardungla 72-kilometer challenge and he walked all of it, if you can believe it. So entire done and done at a pace of 8.5 minutes. So finished even before his coach, who was doubting that he will finish doing the Khardungla challenge. So this is something fantastic. So we have lots of fantastic runners. And yesterday, Dada, of course, went on to win the trail run in Ahmedabad, which is known as the Ravine Run. And it was fantastic again. So I think we've had lots of great points, and this conversation can go on forever. But we'll have to call it a night, and we are ending our September challenge with a bang. We had more than 60 to 70 people and continuously people joining. This will be posted later also on YouTube, and Facebook Live has already been going on. So we'll have the videos available. Okay, so hopefully that gave you enough time to think. Back over to you, Dr. Muthu. You giving us something as a doctor, great points, and then Dada, over to you, and we'll call it a night. Yeah. So.
Yeah, actually, I ran out of charge on my AirPods, so I hope you can still hear me.
Yes, we can. Yeah.
Yeah. So the point, since I have to just close down, I want to tell people here that running is a wonderful form of activity. Don't take it as a sport. Don't take it as a competitive sport, definitely. It's just a physical activity which we were born to do, and we lost out on the way, and just regaining it back. That's all. So that is number one. Don't add too much of competition to it and you will do well. All of us can run. Like I always tell my friends and whoever asks me that there are only two kinds of people in this world. There are people who run and there are people who will eventually run. There's no one who can never run. So if you think you can't run, please call me. Rucha has my number.
Thank you.
The other aspect is that the problem only comes when we set our targets too high. It's not important. Let me tell you just about few kilometers, what you can manage in a day, few minutes of running that you can manage in a day is good enough if you're doing it consistently. And consistency is the key word for everything, but more so for running or any difficult activity that you want to continue doing. And most importantly, amongst everything, distance doesn't matter, timing doesn't matter, pace doesn't matter, your position in your that competition doesn't matter. What matters actually is for how long in your life can you continue running. I have done it for 14 years, and I started off with a lot of people who have stopped doing it now, and the only reason is probably that I took it easy. Somewhere in between, I decided that I should not be so competitive. So that is more important. Running longevity is more important than to be able to run fast or achieve some great. We're not going to go to Olympics, whatever we try. So that's very important. So try and start slow, go low, but aim should be to continue for as long as possible. And if all of us can die running eventually in our old age, I think that would be the happiest moment for all of us. And I'm sure, and before I end, I must compliment Rucha and her team that the activity they're doing. Very few doctors in this country are actually working beyond medicine. And this is my dream, and I always wanted to do it. And I'm seeing people do it like Rucha, and you all cooperating with her and achieving so much. My best compliments to all of you and best wishes for your future. And I'm sure all of you will have a very healthy life.
Thank you. So we'll definitely rope you in for all our future challenges. You can be sure. Yeah. Thank you. I think I like that. Dada, over to you for your messages. Yeah.
Just quickly, like to tell people that whoever is not running, I mean, this is the most, most. You don't have to go to a gym. You don't have to spend a lot of money. I mean, it's just like it's the most cheapest kind of a form of exercise, and which will keep you active. In your office, like in the entire day, whatever work you do. Like nowadays, if a consistent runner, if you ask him like if he's dull during the day, you ask him what is the reason, did you not run today? So it is like that. So his efficiency during the day also drops if he is not running. So this is something which is going to add to your life. I mean, and it can be a lifetime activity. It is definitely a lifetime activity. You can, at whatever age, you can actually go out and run. Other things might stop, but this will keep you active. This will keep you healthy. That's most important. A lot of your health issues will get sorted out if you are into running. So have to be, I mean, this is the best thing to do. That's what I'd like to add.
Great. Thank you so much. And I think, I missed one or two questions. I see Dr. Bhavesh Jaisalpura, and he had asked about immunity and cold, but I will get them answered personally by Dr. Muthu for you. Can we now, Ankit, have everybody on the screen just so I make sure? I want to acknowledge a lot of the runners. I think Urvashi is there. Urvashi is one of our female ultra runners. Did we lose people? Okay, there we are. There's everybody. So I just wanted everyone to be able to say hi to each other. If we can all just show our faces for a second here. Let's all go ahead. And there's Deepa. I see she's joined us also. We have a lot of runners, Dr. Muthu. So the Ahmedabad crowd is very, very thankful. And these are people from all over the country. So thank you for joining. And since we are running a little bit over time, we have lost a few people. But again, thanks to Dada, thanks to Muthu for this wonderful session. And hopefully in the future, again, when you are in Ahmedabad, we would love to have you and run with all of us. And Riga, you have to come from Delhi to run with us. Yeah. All right. Perfect. So any words from anybody? Anyone wants to say anything? Just, it can just be I'm going to start running. I feel like going for a run right away, of course, after hearing all this. So
sure. I feel like going out for a run right now. I'm so motivated.
No, in fact, I would like to know from someone who's never run, is he motivated to run, he or she, from today?
Let's see. Is there someone who has never run? I think most of the people we have done something or the other. But I would say Riga, I know personally, is a fairly new runner.
Or who want to increase their distance. That's also very
Yeah. Yeah, Riga. Do you want to take that up?
Yes, I think so. Yes, absolutely.
Yeah. Great. Great.
Yeah.
All the best.
So she had the question to go from a 5K to 10K. We have Deepa here. Maybe she wants to tell us she's going to run her first 42 next year, but she was not there when you were talking about how a small number of people have run 42. She has joined a little bit later. So Deepa, are you hopefully you're motivated now? And Dr. Muthu is giving you his number, so call him.
Dr. Muthu, did you really start at 40?
Yes, I did
Wow.
start at 40.
Okay.
People do ask me this question many times, and I have a proof for that. So 2010 January was my first half marathon,
Okay.
and I was 40 years old then.
Wow. That's
Wonderful.
so encouraging. I feel like I also have to do, and I will absolutely, this is out to you, Rucha and Dr. Muthu and Dada, all three of you. It will be dedicated to you when I do that.
There you go. And so Deepa, do you want to share
all-
your journey? She started at 41. Do you want to tell us in like a sentence?
I have voice coming from back, but all I can say is that, as everybody says, the most important thing is just start, be consistent. Don't take it too much hard that karna hai, but don't make it like like this thing that I have to finish this, I have to do it. Just keep doing it, be consistent, and nothing is more giving you good time with your running buddies, and that running time that you have given to on that weekdays or weekends. And they're really good times. So I think, once you'll be into this whole running thing, you'll meet people who are also runners, and they'll encourage you and they'll help you to be better and more understanding towards this whole concept of running, rather than just being into that sprinting journey that everybody falls into when they start running. Marathons are more about just going there. It's not about sprinting and giving the best times and all.
Yeah, so Deepa, unknowingly, she refused to run beyond half marathon, but last year in the ADR Night Ultra, she became the first prize winner and finished 30 kilometers without realizing it. So therefore, she's going to do her first full marathon next year, and we all wait to see. Amit, a shout out to you. Can you just raise your hand so everyone knows Amit Kumar Jha? He's the one I said who did the Khardungla, just walked his way up the. How many kilometers was uphill and how many downhill?
Is almost 34 kilometer is uphill, and then remaining is downhill.
So which is of 72 kilometers. So you can do the
Yes.
math. So thank you, everybody. I think I don't want to take any more time. Thank you, Dr. Muthu, again. Thank you, Dada. Please post your questions on the September Health Challenge group if we have missed any, and we'll try to answer those over there. We'll keep the group open for a few more days, even though it's the last day today. And signing off, and have a good rest of the evening, guys. See you soon. See you on the roads, hopefully, some of you, right? Yeah.
Bye.
Bye. Thank you.
Bye.
Thank you.
Thank you.
Bye.
Thank you
Bye.
very
Bye.
much. Thank you.
Okay, thank you all. Bye.